Hello and welcome to my digital short. My name is Shubham and my digital short will be about the research that I developed over this past semester on current kidney dialysis treatment policies. I hope you enjoy it. Imagine needing a building constructed. Instead of an architect though, a construction worker designs the whole building. Although construction workers may have a knack for design, architects would provide a visually pleasing and more cost-effective solution than what a construction worker would provide. In the same way, kidney dialysis clinics in Sacramento County have been underserving their senior citizen patients by not providing physicians during kidney dialysis procedures. Now you may be wondering, what is kidney dialysis? Kidney dialysis is performed on people with bad kidneys. The procedure includes removing dirty blood from kidneys, cleaning it, and restoring it back into the kidneys. Just from this alone, you may imagine that such a procedure is being performed by a physician or other medical professional, but you would be wrong. Currently, technicians are performing kidney dialysis treatment. The refusal of providing physicians to our seniors in Sacramento County is wholly wrong, and therefore changes should be made to this system due to the increased fatalities, decreased communication, worse care facilities, improper training, profiteering corporations, and ethical issues. Sacramento County is a great place for retirees to move in California, and without a doubt, medical care should be improved with this in mind. According to quick facts about Sacramento County written by the United States Census Bureau, a whopping 14.5% of the county's population is above the age of 65. As a result of this, it seems imperative to improve kidney dialysis clinical care conditions since the individuals who are receiving care are at ages where their lives are extremely fragile. Another reason to provide better care is the overall increase of life expectancy from the Centers of Disease Control, or the CDC, which shows that from 1900 to 2017, the life expectancy has increased from 47.3 years to 78.6 years. This is 31 more years of life than ever. Therefore, the medical field needs to learn to keep this number higher by providing better care to the oldest citizens in our society. The fragility of their lives seen here shows that their immunity levels will be much less than a younger individual and therefore require better care compared to a younger individual. The current care conditions in Sacramento County have caused an increase in fatalities in kidney dialysis clinics. Old people are fragile as it is, therefore with good care provided to them, the occurrence of people crying near a hospital bed, as shown here, will be reduced. Now to bring some statistics to the mix. In 2019, Dignity Health created a report that outlined the community's needs. This report had statistics of how people had died. As seen in the chart on the left, the highlighted number of 3.9 signifies the number of deaths out of 100,000 that occurred as a result of kidney dialysis, as a result of kidney disease. Although this number is minuscule in the grand scheme of deaths that occurred in the same year, its comparison is being done by a similar report written in 2016 that is shown on the right. Taking a look at this chart from 2016, 0.649 per 100,000 people died from kidney dialysis, or disease. This was calculated by taking averages for the highlighted numbers. This number is lower than the 3.9 out of in the 2019 report. As you can see from this statistic alone, that the kidney dialysis treatment is not being performed properly and as a result is increasing the number of fatalities. Physicians, though, can reduce the deaths from kidney dialysis. Technicians don't have the same expertise that a physician can provide. As seen here, a phlebotomist, a kidney dialysis technician, is performing treatment on a patient. Although it may seem that the phlebotomist is perfectly capable of doing their job, I'll explain in my next slide why this may not be entirely true. The infographic here is showing that a phlebotomist requires less than 1 year education, which can be performed at a trade school. Due to the severity of medical conditions, I find this education insufficient, since as stated before, kidney dialysis is the procedure of removing and cleaning dirty blood and then restoring it back into the body. The sheer complications of this make it seem like a terrible idea to employ technicians without a physician's supervision. The prescriptions of medications at the hand of a physician is more credible than that of a technician. Physicians' time spent in school relates to how they can understand what can happen to the body when prescribed a certain medicine or treatment. As a result of this, their likelihood of performing such a mistake unknowingly will not be common. Another clear indication of this is the fact that doctors prior to attending medical school are required to know all the major life sciences, biology, chemistry, and physics. With understanding of these concepts alone, it is reasonable to believe that their prescriptions will work most of the time. To build onto the benefits of a physician in kidney dialysis clinics, training of a physician is unparalleled to that of a technician performing the same treatment. The infographic here shows the different levels of a doctor from medical students to attending doctors that are available at a hospital. As a result of the hierarchy here, physicians have the ability to gain experience from a junior to senior level without experimenting on their own, and therefore helps them to develop unique treatments with ease. This is an example of the hierarchy at play. The attending doctor is closest to the patient and seems to be communicating with them, while the other patients are in the back taking notes and and observations in order to figure out how they should go about treating patients on their own as well. Patients will not listen to technicians as much as they will a doctor. As seen in the picture, the patient and the physician seem to be sharing a connection. The trust here is represented by the close proximity and the handholding, which signifies the confidence that the patient is putting into their physician. This type of connection is unlikely when in the presence of a technician. The brain shown here is representing that most of what a physician-patient relationship entails is psychological. Although a technician could speak from experience, a physician has developed an ethos that makes them more approachable, and their recommendations are taken into account by the patient at all times. Now to talk more in terms of how the chemistry between doctors and patients' conversations are. This Venn diagram is a clear representation of this. Patients are willing to share intimate details with their physician that they may be facing, and in the same way physicians share their experiences. As a result of this, they are able to come onto common ground for one another to understand how to proceed with the treatment. The overall costs of a doctor are minuscule compared to the grand scheme of running a kidney dialysis clinic. From the Bureau of Labor Statistics, the highlighted number of $210,140 is a representation of the cost to employ a physician in California. Now, this price may seem extremely high for a kidney dialysis clinic to use, but the operating cost for a clinic shown here can cost $100 million, according to the specialty care data collected by the California Human Services Open Data Portal. Does that bring some perspective to how minuscule this cost would be, or what? As you can already see, physicians should be in kidney dialysis clinics because of this image. What we see here is a distressed relative who seems to have lost a person close to them. Since throughout this presentation I have stressed the saving of lives, this image represents why physicians should be in the kidney dialysis clinics to reduce the occurrences of such a scene. Physicians are held under strict rules and as a result will be non-discriminatory in their approach in medical science. Here we see a group of medical students reciting the code of ethics they have to follow. In a profession like medicine where human lives are at stake, these ethics being recited truly shows the level of discrimination that will not occur in the presence of them, which would otherwise be experienced when getting treated by a technician, who may not have the same moral codes drilled into them. Although I'm not claiming that technicians are inherently discriminatory, it is more likely to occur due to these compasses not being developed at a school level. Another reason for less discrimination can be seen in this chart by the Association of American Colleges, where the racial makeup of doctors in California is shown. Although the white population is significantly larger than any other races, it can be noted that there are some populations that are also sizable in their own right, such as Asians and unknown races have a large share in the physician makeup of California. Companies who provide kidney dialysis care have increased profits but are not using this money to build a better healthcare system for kidney dialysis patients. Kidney dialysis companies have a way of always showing that they don't have enough money to provide care. I think this is quite the contrary. According to the New York Stock Exchange on December 2nd, you can see that a single share value of DaVita Incorporation, a kidney dialysis company, has had a share price of $108.36. Now, if you look at the trend of this graph, you can see that the value of each share has risen from its initial public offering in 1995. Therefore, it seems that this money is not being used to provide better care and rather more money for executives. Since stock price could be a swayed version of the overall health of a company, a map of all the locations in Sacramento County of all the DaVita kidney dialysis centers can give you a better idea as to how much money they truly have. It has 15 locations in Sacramento County alone. DaVita is more than profitable to provide better care, proper care, health care in the form of physicians at these clinics. Physicians can provide hygiene care that would not be in place if other medical professions professionals were not there. Hygiene is a key part of making sure that treatment is performed properly. Without the incorporation of a physician in such sites, technicians will not understand the implications of not thoroughly cleaning equipment. In the case of a physician, they will abide sheerly due to the malpractice costs that will incur as a result. The graph here shows the malpractice insurance costs by state. California is at roughly $5 million. Although not as large as some other states, this cost alone keeps physicians from adopting wrong hygiene practices. Thank you for listening to my presentation, and I hope that due to this video your opinions are more informed about physicians and kidney dialysis clinics. Propositions like Prop 23 proposed in the past November election are quite common, and therefore by understanding the points through this presentation, I hope that your votes are more informed in the future. Thank you. And here are my works cited references.